by CC. I'm aware that many of you that are probably dialing in, I have had some kind of relationship with, served with in the past. And thank you for all of your questions and your concerns. The bottom line of what we're doing here is that we want to get after the facts of what is going on and what policies are being changed, what benefits are we pushing forward in the midst of the stop movement, and also while this pandemic response lasts. So I mentioned previously that we need every NCO and petty officer to be the calm in the eye of the storm, to be the conduit of proper information, to ensure that our people's minds, including their families, are at ease. So we're going to be discussing some of those key things. And I will tell you that there's a couple of common themes in the questions that you have pushed forward. A lot of them have to do with money, time, relocation issues, and separation of families. So hopefully we will get through that in the next 30 minutes. What I'm going to do is I have a team here and I want to say thanks to them. By the way, disclaimer here, no staff personnel have been harmed in the conduct of this town hall. They're all 6 feet apart, wearing masks and taking all the precautions that they need to do. So they're going to be feeding me the information, and I'm going to be reading the questions, and then I'll be giving you an answer. In the event that we don't have an immediate answer for you, keep checking the post on our Facebook page, because we're going to follow up to every single query that is in there, and we will provide answers. And if you like the page, you can stay informed real time on everything that we're doing. That is one of the sole reasons why I have a Facebook page. It's just to continue to feed you information. I would like to also welcome a few of my peers that I dialed in today, including our very own Chief Master Sergeant of the Air Force, Khalith Wright. Thank you, brother, for being here, and any Air Force related questions, I will go ahead and shoot your way. And also the Senior Enlisted Advisor to the Space Force, Chief Master Sergeant Toby Toberman. Thank you. Additionally, our brother from the United States Marine Corps, Sergeant Major of the Marine Corps, Troy Black, will be dialing in. And I also would like to let you all know that this is a united effort across the services and the Joint Staff to ensure that our total force is taken care of. Lastly, I would like to let you know that the Secretary of Defense, the Chairman of the Joint Chiefs of Staff, and I are in continuous conversation with the Chairman daily and with the Secretary very often regarding your feedback. So again, I cannot understate the importance of you telling us what is it that is going on in your formations, so that way we can address it with either the services, your combatant commands, or the leadership here at the Pentagon. So without further ado, I'm going to go ahead and start going through the list of questions that we have. And the first one is coming from one of our spouses in Laughlin Air Force Base, Kelsey Dunning. And her question is, will there be any reimbursements to families affected by stop movement, and who are now paying for 2 houses? So 2 separate households affected because of the stop movement. Now, there's plenty of provisions in there, and I highly recommend going to the finance office to get the specifics for every given case, because no particular regulation is going to cover all cases. But the bottom line is that our finance offices are working in continuation of basic allowance of housing for those people that are quarantined. They're also working on family separation housing allowances for members PCSing from CONUS to CONUS basis that are holding 2 households. I specifically asked this question last week because we had another question coming via Facebook of a member that was stationed in Fort Bliss. Their spouse was here in Fort Belvoir. Their PCS was stopped and they were having to incur costs because of the housing that the spouse had to live in. And the Office of the Secretary of Defense we're working on ways to be able to go ahead and compensate our members due to any COVID-related issues. So thank you, Kelsey, and please log in again into our webpage for specific answers to your particular question. But because of the sake of time, we want to keep things a little bit generalized. But the fact is that we're working every issue on case-by-case basis, but at the end of the day, and the bottom line, is that we want to make sure that our families and our service members are taken care of. The next question is coming from Sam Sneed in Germany. And the question is, any movement for people who have shipped household goods? This conversation I had with my spouse, Janet, when this first began, this meaning the stop movement order. And our main concern was not only people that had shipped household goods, but that now were without a POV, without privately owned vehicles, that were pretty much staying in temporary housing without the ability to go ahead and go to restaurants. Oh, and by the way, the restaurants closed. And now everything was takeout. But without vehicles, it was something that was going to be very, very difficult for our people. So we discussed with the services on ways that we can ensure that the sponsorship programs on basis are following through, helping their teammates to make sure that they have everything that they need. We have had an overwhelming response of people attesting to taking care of others, which is a great thing. But we're also working up here at the staff. What is the priority going to be once the stop movement concludes, or when we actually relax some of the restrictions with it? So clearly there's going to be an order of priority on how we're doing, because there's only going to be so much capacity to be able to move everybody that is on hold right now. And given that this can potentially go through the main PCS season, it's going to create a backlog. I will tell you that every single service right now is developing plans of actions to make sure that we properly prioritize and move people. Hardship is going to be one of those factors that we're going to put in there. People that are without their property is also a factor that we're going to place in there. People in positions of responsibility, mission essential personnel, is going to be part of that equation out there. But we want to make sure that we continue the dialogue with your chain of command to make sure we know exactly who's being a subject of this hardship and what action we need to take to best take care of you. So again, Sam, thank you so much for that question, and it's very important and relatable to a lot of people. So the third question here is from Tech Sergeant Rico in Hill Air Force Base, Utah. And he asks, any hardship pay for troops in quarantine returning from deployment? We actually did a little bit of research on this one to make sure that I gave you the right answer. So if you don't mind, I'm going to read you the 4 criteria for people to get reimbursed for any expenses incurred while in quarantine. So the type of pay that you're referring to is hardship duty pay restriction of movement. HDP-ROM is the acronym. So for COVID members to be eligible, they have to meet the following criteria. So they have to be separated or quarantined due to a result of the effects of COVID-19. A commander orders the member into restriction of movement or self-monitoring. The second criteria is the commander determines government lodging in kind is not available. Third, the member incurs a cost for the additional lodging during this period, where such lodging is separate from lodging the member occupied before a commander order period of self-monitoring, isolation or quarantine, or is separated from lodging that the member otherwise will occupy, but for the commander order period of self-monitoring. A lot of words in there, but bottom line is somebody tells you that you need to quarantine, there's a mechanism to go ahead and reimburse you for it. And then the last criteria is the cost of lodging is neither reimbursed nor otherwise subsidized by DOD or any entity, i.e. double payment. So again, there are mechanisms, and we're going to go ahead and post all of these answers and the criteria on our Facebook page to make sure that anybody can reach that and then communicate with their chain of command for the reimbursement. All right, so we're working right through this, so keep the questions coming. The third question, or the next question, is will use or lose leave be increased to address spring break summer leave issues due to COVID-19? The answer is that we're currently and aggressively working on a course of action to treat this the same way that we do deployments, to where you're able to carry over leave. Now, it is not finalized yet, but I will promise you one thing, that I have been your strongest advocate, along with the chairman of the Joint Chiefs of Staff, to make sure that this happens for you. We're going to continue to fight for you, and it is simply just the right thing to do. A lot of weddings, a lot of planned leave, spring breaks for a lot of families have been canceled because of this stop movement. And we want to make sure that you get that time back to be able to enjoy it with your family. So thank you again for that feedback, and we will fight this one until we get it right for you. All right, next question. What exceptions are there for staff movement order? And this is coming from Staff Sergeant Dadiel Vega. Two last names, but they're both the same, unlike this guy right here. But all right, so exceptions there for staff movement order. Commanders at all levels have been provided the criteria for hardship, mission essential, and any other circumstances that deem the member clear for movement. We're still tracking all of those exemptions to policy, but you have to remember that safety of the force and safety of your families is paramount. A lot of members that are asking these questions are coming from highly contaminated areas. And we want to make sure that we keep listening to the commanders and their senior enlisted on the ground on their best advice for movement of people. There's going to be other cases to where we may need to move personnel. But the most important thing is for you to bring the case over to your chain of command to make sure that they're aware of everything that is impacting you. And if it's financial, separated, related, or anything else, also let that be known, because there's other provisions that we can go ahead and mitigate the hardship to you and your family in the process of the stop movement. So again, Jadiel, thank you very much for that question. Next, this is coming from an Air Force veteran and contractor, Jennifer Lavarge at Lewis McCord. And her question is, when will troops, civilians, contractors be allowed to move or PCS? Clearly, the rules right now for the stop movement, this current round of stop movement goes for the CONUS base for the continental United States until 11 May, and for overseas locations 23 May. The difference in between the 2 days was the date of notification for some of those places. Now, right now, there's a discussion of what's going to happen next. Will this be extended? Will the stop movement be rescinded? COVID gets a vote. And until we get to see the spread of the disease peak and start coming down on the downward spiral of risk for infection, we need to maintain the CDC guidelines in place. And that includes prevention of movements of certain people. There's going to be, however, provisions to make sure that as this prolongs, if it gets extended, for us to go ahead and get more aggressive on the case-by-case basis to make sure that we take care of our people if it's a dire need for them to be able to move or the need to move. Also, when it comes to deployers, the same thing. We're also aware that there's a lot of replacement in place, transfer of authority that is halted right now. We're looking at ways to ensure that we meet those demands and that we bring our people that are deployed home on a timely basis and not keep them extended too long. Those conversations are ongoing right now. And here in the next few days or few weeks, we're going to get some answers to that. But right now, it's pending approval from the Office of the Secretary of Defense to see how we're going to move forward on this. We're getting a lot of feedback from the medical community also on what we need to do in order to go ahead and get services on post to be able to go ahead and come back. Barbershops, food courts, and things of that nature. Again, COVID gets a vote, and we need to make sure that we do everything to the greatest extent to keep our people safe. So in the meantime, please stand by, and as soon as we get the word and the thumbs up on what's going to happen next, I will make sure to put it in our Facebook page, and I'm also going to communicate it with your service senior enlisted leaders to make sure that we're all tracking and that we're also passing the information that is going to go ahead and give you a little bit more detail on what we need to do. Next question. And this one is coming from Senior Master Sergeant Orozco at Ramstein. And his question is, any consideration to a planned transition back to normal to prevent additional stressors on operations? All right, so Senior Master Sergeant Orozco, here's the bottom line, that this pandemic is unprecedented. This pandemic is something that still doesn't have a vaccine. And this pandemic is going to go ahead and put restrictions on a lot of us for quite some time. The new normal is the right answer to put here. Normal as we knew it can potentially change. There's going to be a lot of changes to norms in society. There's going to be a lot of changes to procedures on the way that we used to do things, from grocery shopping to the way that we interact with people, the way that we conduct meetings, the way that we conduct training for that matter. So it is more based on a new normal than things normal as we used to know them. Now, that is going to be faced based on the medical intervention that prevents the spread of the disease, and number two, the safety of the people. And I hate to sound like a broken record on this one, but the bottom line is that we cannot afford to keep people getting sick, because the most trained resource that we have right now are the medical professionals that are available to go ahead and take care of our people. So the more safe we are, the less strain on them, and the more they can handle the people that are already infected by this virus. So again, I ask you and urge you to please continue to be patient. Think of ways that we can go ahead and get through this. And at the end of the day, we will have a hell of an after action report to go ahead and discuss on how we beat this thing. But again, stay focused and make sure that you continue to take care of your people. And I appreciate your question. All right. So we have another question here. And this one is unanimous, and it's coming from an unanimous spot. Imagine that. So what consideration has been given to treatment and post-service care service members contracted COVID-19? Now, this question came about yesterday also when I did the town hall with the Secretary of Defense and the Chairman of the Joint Chiefs of Staff. And my answer is the same. We're going to treat COVID-19 like we treat every other ailment that a member has. Number one, it will be in your record, so we need to make sure that medical professionals are tracking that. Number two, we'll make sure that we track the treatment of anything post, because we don't know anything about what's going to happen next for those that were infected. So we're going to continue to search those treatment mechanisms and medicine that accompanies people affected by this. And then lastly, I mentioned that once you depart service, we're going to make sure that we do another assessment on your health to make sure that number one, your VA benefits are covered, and number two, that you have a proper care plan once you leave our ranks. So again, we're looking out for the health and welfare of our people, but also for the long-term effects of what COVID is going to be doing. We ended up getting some information here. And this one here is from the first question that came from Laughlin. And here's a few options over here for the hardship exception to policy. So it says, the airman may request an exception to policy to travel due to hardship. This may be approved by the first general officer or SES in their chain of command. It also states that relief through service members' Civil Relief Act. And that is, if a member signed a lease at the new PDS prior to departing the old PDS, they may be able to seek relief in accordance with the Service Members Civil Relief Act enacted in 2013. So again, that's yet another mechanism to be able to go ahead and cover for some of this unprecedented costs that a lot of our families are getting. The next question that we have here is from one of our Army counterparts and somebody that I know very well. And this is Master Sergeant Vincent Peltier, who served with me in the United States Africa Command. So his question comes from the Defense Security Cooperation Agency support and their response to COVID. And his question is, are reserve component units that are designed to support and train for DSCA, Defense Security Cooperation Agency missions, able to use the authorizations in DODD 100 TAC 2, which is labeled Support and Services for Eligible Organizations and Activities Outside of the Department of Defense, to augment local emergency coordination centers. Now, it is important to understand that all of the support that the Department of Defense is provided is based upon the request of FEMA. Once FEMA brings a request forward, we go through a process to make sure that number one, we have the assets available for what they're asking for. Number two, what is going to be the proper allocation and timeliness of those assets? And number three, for how long we can sustain that support to those organizations. Now, when it comes to this particular case, I am not familiar because I'm not familiar with the DODD 100-2. But we're going to go ahead and run that to ground. And again, Vince, we're going to go ahead and put that reply in our Facebook page to make sure that you are informed on anything that can be done in order for people to go ahead and support. Another thing that I would like to point about on this question is that I have gotten numerous posts and requests from retired personnel that are wanting to volunteer to go ahead and continue to support the efforts in the fight against COVID-19. The best case is for those particular personnel that have some expertise that want to go ahead and participate to go through the local governor's office to ensure that they know that they're available and willing to be able to go ahead and do whatever needs to get done. I have also gotten requests from some of my peers that are currently working in New York City as an example, which is one of the most affected cities in the United States of America, or the most affected city. And everybody out there is just coming forward to go ahead and support the cause. And most importantly, they're asking how they can support the military community to ensure that they have the mask and all of the resources that they need to go ahead and continue to affect the mission as this goes on. So again, thank you, Vince, for that question. And it's something that I personally haven't looked into, but now we will. And that is the beauty of this. This is two-way communication, and your feedback matters, and it's going to help us go ahead and respond better to the way that we're dealing with this response. So again, much appreciated. All right. Then we have a couple of Air Force specific schooling and promotion questions. For those, since the Chief Master of the Air Force is online, I'm going to go ahead and read the questions to you, but I'm going to have both the Chief Master of the Air Force, Khalid Wright, and the Senior Enlisted Advisor to the Space Force, Chief Master Sergeant Roger Toberman, Toby, to be able to answer those. Now, the first question is, this is from First Sergeant Smith from Patrick Air Force Base. And he asked, are there any exceptions to policy because of PME, professional military education backlogs, or stop movement? Any impacts to promotion testing? The second question is from Kevin Campbell from Alconbury. And his question is there any talk of E6 weight airman promotion system testing being canceled this year? The answers to those, I can tell you that across the services, a lot of people are pressing with the boards to be able to go ahead and keep the promotion systems going. Just like we're keeping basic training, on a safety distance method going to be able to ensure that we continue the safe training of our people and keep feeding the wartime machine that we need to ensure readiness. Now, something else that has come up outside of the Air Force questions, that is with regards to the force writ large, is any stop movement. Because of the decrease in accessions into service, naturally people will ask, well, that's going to create a bathtub. And then we're going to need to go ahead and stop people from leaving in order to go ahead and maintain the force healthy. The Secretary of Defense yesterday stated that that is only going to be used as a last resort, and that every option on any particular MOS rating or AFSC that may be critical or affected by the decrease of sessions into service may be considered for extensions and so on. But right now, the answer to the stop loss is only used as a last resort. So please continue to share that with your people. Another question that came about, and this is from a parent that has a service member getting ready to deploy sometime in September. And that question was asked, was the member going to be able to go ahead and take leave prior to their deployment so that they can spend some time with their family? September right now is a little bit too far, and again, we need to keep close watch on the effects of COVID on the population. because that's going to drive the lift of any restrictions. So more to follow on that. As of right now, the end date for this particular stop movement is 11 May for the United States and 23 May for any units overseas. And again, more guidance is going to come here in the next week or so on whether this is going to be extended and what restrictions are going to be rescinded, relaxed, or lifted. Now, let's see what else we got in here. So we have covered quite a bit, and we got about 5 minutes left on this Facebook Live. And we have, oh, this is good. So this is going to be a good news story. And this is actually coming from one of our peers, a command senior enlisted leader, who ended up, his wife ended up giving birth to their baby girl here in the last couple of days. So Master Guns Scott Stalker, it is the proud father of baby Grace, who is healthy and well. But I want to read you what Scott said about his experience in the middle of all the turmoil that we have going on with COVID-19 and how professional our medical personnel have been in still taking care of people. And I'm going to read you verbatim what he wrote because this is a great note. And he wanted to for me to pass on, and I quote, "Our time during prenatal medical checkups at Walter Reed, Andrews Air Force Base, and Fort Belvoir, along with the birthing process at Fort Belvoir, was done with the highest level of professionalism and kindness. In the midst of this pandemic, we still receive high quality care and customer support. We wouldn't be more appreciative of our medical professionals. I realize that there is some consternation about military medicine, but our recent experience tells us that our service members and their families are well taken care of." So again, congratulations, Scott, and I want to thank all of those medical professionals in every single one of those locations and abroad for their professionalism and their dedication to the health and welfare of our force. So we have a couple of minutes, and I just wanted to provide a couple of closing comments here. The first thing that I would like to point out is that this conversation doesn't end in 30 minutes. This has got to be a recurring dialogue between us and you, your needs, so that way we can go ahead and develop solutions to care for you. The next thing is that families and dependents are not exempt from this. You got to hear many questions from people that are separated from their loved ones. I need to know what is it that we need to do for you. I need to know what is the hardship that you're facing. And I need to make sure that I provide you some relief for that hardship. That is my sole purpose here at the Pentagon, is to take care of every single one of you. So please allow me the opportunity and the honor to take care of you. And lastly, is that we're going to go ahead and continue to do this live town halls via Facebook. The frequency of them, sometimes it's going to be based on the ability of my peers, because I want to make sure that I keep bringing other services in to make sure that they're listening to the voice of the Joint Force. But also when new updates come about, that I want to have a frank conversation with you. I'm not going to pull any punches. I'm not going to give you political answers. I'm just going to give you the facts. All right. If I don't have the answer, I promise you that you will see a post there in either 2 minutes or 2 days. That is my promise to you. So again, I want to thank the staff here for the continued support to everything that we do. And for those of you that didn't have an opportunity to see video, or if you had any technical difficulties, we're going to post this entire video. We're recording it for those of you that didn't get a chance to go ahead and either witness it live or didn't have the bandwidth to go ahead and stream it. So that video is going to be posted both on Facebook and also on my LinkedIn page. So we're going to provide you those addresses. So please continue to stay tuned. Thank you so much for everything that you're doing. Thank you for being patient, and please trust us that we're doing everything in our power to make sure that we continue your lethality and your care. So again, SEAC out, and thank you so much.